Okay, so you've been through the treatment, maybe it was surgery, maybe something else pretty intense. You've navigated the whole hospital experience.
Right.
And then you're home. What actually happens next?
Yeah.
The sources we looked at for this deep dive really hammer home that this period, after you leave the clinic or hospital, it's just as crucial, maybe possibly even more crucial for a good, safe recovery.
Absolutely. That phase, it's often way less structured than the actual treatment phase,
Mhm.
you know? And the focus really shifts onto you, the patient, and whoever's helping you out at home.
Right.
What you do, or maybe what you don't notice, in those first days and weeks,
Mhm.
it can seriously impact how things turn out long term.
Exactly. So for this deep dive, we're kind of pulling back the curtain a bit. We'll look at the systems that are supposed to ensure healthcare quality and safety, the standards hospitals are aiming for. But then we're quickly pivoting to what our sources highlight as just this absolutely critical piece of the puzzle, your role, your part in watching for complications once you're back home.
Yeah, we've pulled insights from places like the websites for big accreditation bodies, Joint Commission International, that's JCI,
Yeah.
and NABH here in India,
Okay.
and also info from healthcare consultancies like Supreme Medical. They actually help hospitals get ready for these accreditations.
Yeah, interesting.
And then specific guides that are really focused on that post-treatment monitoring, spotting the warning signs.
So our mission today really is to give you a sense of those quality systems working behind the scenes, but then more importantly, to arm you with practical, usable knowledge.
Right.
So you can be prepared, watchful, empowered really in your own recovery. We want you to know what signs need attention, what to do about them, because the sources just keep saying how vital that is.
And healthcare quality, it's got so many layers. It's protocols, staff training, how they handle infections, the building standards.
Yeah.
It's all meant to build this safety net inside the hospital.
Okay, let's touch on that first, just briefly. What actually sets the standards for quality and safety globally and specifically in India, based on our sources? Not the boring org charts, but what does it actually mean for you?
Well, globally, Joint Commission International JCI is a huge name. The sources paint them as setting really tough international standards, all focused on quality care and keeping patients safe.
And hospitals choose to go through this.
Yeah, they volunteer for JCI evaluations to prove they meet these high standards.
Wow. And they operate everywhere, right? The sources mention something like, over 70 countries?
That's right. And they have these specific things called International Patient Safety Goals.
Okay, what are those about?
What's interesting is they target really common problem areas. Things like making absolutely sure they have the right patient before doing anything. Improving how staff communicate with each other, preventing infections. It's all about systematically cutting down the risks for you while you're in their care.
Okay, that makes sense.
Exactly. Their whole standards framework is designed to push healthcare organizations to constantly measure how they're doing, figure out where they can improve, and then actually do it, especially in ways that affect patient results.
So it's like an ongoing commitment they invite outsiders to check up on.
Pretty much, yeah. It's a commitment to excellence, verified externally.
And then closer to home, here in India, the sources pointed to NABH.
Yep, NABH, the National Accreditation Board for Hospitals and Healthcare Providers.
Okay.
They do a similar job, but specifically within India, they're part of the bigger Quality Council of India structure.
Right.
And their main job is setting up and running accreditation programs for healthcare places here. The goal is basically to meet patient needs by setting clear benchmarks for the whole industry.
So why do hospitals go through all this? It sounds like a lot of work getting accredited by JCI or NABH. What's the payoff?
Well, the sources mention testimonials, and they point to some real benefits. Like the process itself forces teamwork, improves how departments talk to each other, things that, directly impact your care.
Okay, I can see that. Better coordination.
Right. And it also boosts the community's confidence in the hospital, helps manage risks better. It basically organizes all their efforts around making things safer for patients.
So it's about building a safety culture, not just ticking boxes.
Exactly. That's the idea. The sources suggest it adds real value and makes patients feel more confident, knowing the place has passed these tough checks. And it's not just abstract. Companies like Supreme Medical Consultancy, who we saw mentioned, they actually exist to help hospitals do the practical stuff needed to meet, say, the NABH standards. It just shows there's real effort involved in putting these quality ideas into practice.
Okay, that sets the stage inside the hospital. But let's shift now. Let's talk about after you leave. Because while those standards and checks are vital, the sources just keep coming back to this. Your safety, your recovery success really hinges on what happens once you get home.
And this is where it gets, well, honestly, pretty sobering. Did you know, the sources point this out, 75% of hospital readmissions happen within just 15 days of going home.
Wow. 75% in 2 weeks.
Yeah. And get this, nearly half, 50% of surgical complications don't even show up until after you're already home.
That is stark. Really drives home that the journey isn't over when you walk out the door.
Not at all. And that's exactly why your role becomes so incredibly important. The sources suggest that proper monitoring, keeping an eye on things after treatment can actually prevent something like 60% of serious post-treatment problems.
60%. So your watchfulness isn't just a nice to have, it's a major factor.
It's a powerful determinant of success. Yeah.
So it's not just about resting and taking it easy. You need to be an active participant, really informed during that recovery time.
That's it exactly. What you or maybe your caregiver watches for after treatment is honestly just as vital as the care you got during treatment. Recovery isn't passive. It requires active observation.
Okay, so this leads to the big question. What exactly should you and your caregivers be looking for? What are the signs? The sources gave quite a bit of detail here.
They did. There's a sort of baseline list of general signs that should always get your attention. Things like a fever developing,
right?
Any increasing redness, swelling, maybe pus, or just more pain around a wound or where an IV was,
Yeah.
feeling short of breath or having chest pain, feeling really weak or dizzy, like unusually so, vomiting or diarrhea that just won't stop, suddenly gaining weight or noticing swelling in your feet or ankles that can signal fluid building up, jaundice.
The skin or eyes looking yellow. And this is important, any real change in how alert someone is or if they seem confused.
That general list is helpful, but the sources also had this more detailed thing, a red flag symptom checklist.
Oh, yeah, I saw that. What I liked was how it broke things down based on the kind of treatment you had.
Exactly. Super practical.
Yeah.
So for surgical patients, it really zooms in on the incision site.
Makes sense.
It says watch for redness or swelling that spreads, like bigger than a quarter. Any yellow or green pus, that's a bad sign. Or if the wound edges suddenly pull apart.
Okay.
And internal warning signs after surgery. An unexplained fever, specifically over 100.4 Fahrenheit or about 38 Celsius.
Right.
Or new pain, or pain getting worse that your pain meds aren't touching, and any kind of foul smell coming from the wound.
And what about for people who had medical treatment? Not surgery, but maybe meds for an infection or something.
Yeah, for them, the checklist highlights medication reactions more. Things like a rash or hives popping up.
Okay.
Or, seriously, a swollen tongue or lips that could be a major allergic reaction. And they specifically call out black or terry-looking stool as a possible sign of bleeding inside your gut.
That's a critical one to know.
Definitely. And sort of system-wide alerts for medical patients include sudden confusion or disorientation, shortness of breath, not just when you move, but even when you're resting.
Wow, okay.
Or if you simply cannot keep any fluids down.
The sources also mentioned the types of complications these signs might point to, right?
Yeah, they're listed common culprits. Infections are a big one at the surgery site in the bloodstream, UTIs. Breathing problems like pneumonia or a dangerous blood clot in the lungs, a pulmonary embolism.
Scary stuff.
Heart and circulation issues too, like other blood clots, heart failure kicking in, or irregular heart rhythms, arrhythmias. Managing pain effectively is itself a category.
Right.
GI issues like ongoing nausea, vomiting, or constipation.
Yeah.
And, importantly, they include mental health changes, watching for significant anxiety, depression, or just completely overwhelming fatigue. It's a broad range. Which raises another key question. How do you know if a symptom needs an immediate 911 call versus just calling the doctor's office?
Yeah, that distinction is crucial. When is it an emergency?
The sources give pretty clear guidance. They say call your doctor or clinic right away if you get 2 fever readings in a row over that 100.4 F38C mark.
Okay, 2 consecutive high readings.
Or if you have new chest pain or find it hard to breathe. Or if you suddenly just can't put weight on a leg or arm.
Got it. Call the doc for those. But when do you go straight to the ER?
Head straight to the emergency room or call emergency services for the really alarming signs. Blue lips or fingernails, that means not enough oxygen.
Okay, that's serious.
Uncontrollable bleeding, any loss of consciousness, even brief.
Right. No messing around with those.
Absolutely not. And the sources are really firm. Don't try to self-medicate or cover up these kinds of serious symptoms without talking to a doctor first.
Yeah.
Don't just pop a painkiller and hope it goes away.
Good advice. Okay, so we know what to look for and when to act. Here's where it gets really practical, though. How can you actually manage all this monitoring? It sounds like it could be overwhelming, especially when you're not feeling great.
Yeah, it can seem like a lot. The sources suggest tailoring it based on your risk level, which your doctor might help define.
Mm.
For patients considered high risk, they actually recommend daily checks.
Daily. Okay, what does that involve?
Tracking vitals like temperature morning and evening, maybe blood pressure and oxygen saturation, if that's relevant to your condition. You know, the little finger clip thing, the pulse
Right.
oximeter.
Uh-huh.
And for surgical patients, daily wound checks are key.
You mentioned photos.
Yeah, they even suggest taking a quick daily photo, maybe with a ruler beside the wound, to track any changes in size or redness objectively. And noting drainage, they use the comparison of a quarter-size spot on the dressing being about a teaspoon of fluid.
That's a helpful visual.
And maybe simple function tests, like just walking 10 steps and seeing if you feel dizzy, or checking your grip strength if that's relevant.
And for people considered moderate risk, less frequent?
A bit less intense. The sources suggest maybe checking things every 3 days or so. That could include tracking your weight, because sudden gains can mean fluid retention, which doctors need to know about. Keeping a quick log of how well your meds seem to be working, and maybe tracking your range of motion if physical recovery is part of it.
Okay, that seems more manageable. What about tools? Did the sources mention anything to help with this?
They did. They covered a range, actually. Some pretty high-tech stuff, like specific apps for monitoring incisions. Healthy.io was mentioned.
Ah.
Apps that remind you about meds but also let you track vitals, like one called Pillow. And remote devices like Bluetooth thermometers that sync data, or wearable pulse oximeters.
Wearable tech. Okay.
Some hospitals even have their own platforms, like apps where you can track your recovery progress and it might connect back to your care team.
But what's fascinating here, you mentioned this earlier, they didn't only talk about high-tech solutions.
Not at all.
Ah.
Alongside all the apps and gadgets, the sources strongly endorse good old low-tech methods, especially the simple recovery journal or daily logbook.
Just a basic notebook.
Yep. Described as incredibly valuable. Just writing down the date, the time, what symptoms you noticed, your temperature reading, maybe notes on how your appetite was, energy level, sleep quality. Did you miss any medications? What was your pain level on a 1 to 10 scale? This simple act of writing it down creates this objective record. Things you might forget or downplay later become clear trends for your doctor.
That makes so much sense. And the role of the caregiver came up again here, right?
Oh, hugely important. Family, friends, they're described as absolute lifelines, especially if the patient is feeling weak, maybe a bit confused, or just isn't someone who notices subtle changes in themselves.
Right. They can be the objective eyes and ears.
Exactly. They should watch for changes in speech, movement, alertness, appetite. Look for nonverbal cues grimacing that might mean pain, unusual fatigue, and be ready to speak up for the patient if needed.
And help with the practical stuff, too.
Yeah, helping document those changes in the log, assisting with things like changing dressings, reminding about medications. It's a team effort.
Okay, so monitoring at home is key. The sources also had some great advice about things to ask before you even leave the hospital or clinic. Setting yourself up for success.
Yes, getting clarity up front is huge. They listed some really practical questions to ask your doctor or nurse.
Like what?
Like, what side effects are considered normal for my recovery and what isn't normal? How do I know the difference?
Good one.
At what point should I actually start worrying about pain or fever or swelling? Who exactly do I call if I have symptoms in the middle of the night or on a weekend or a holiday? That's a big one.
Definitely. Knowing who to call and when.
And will I need any follow-up tests or scans during my recovery period? Just getting those answers before you walk out the door can reduce a lot of anxiety later.
And they even provided that little script for when you do need to call.
Yeah, the 3-question call script. It's brilliant because it helps you be really clear and efficient when you contact your care team.
How does it go? Simple structure. First, I'm however many days after my procedure treatment, and I've been experiencing the specific symptoms since about what time they started.
Okay, clear context.
Second, add data if you have it. My vital sign, like temperature or blood pressure, is the reading compared to my usual baseline of baseline reading, if known.
Give them numbers.
Right. And third, ask for clear direction. Should I come in to be seen now, or is this something that can wait until your next appointment, or maybe tomorrow?
That's great. Gets right to the point.
Gets you the info you need quickly. They also touched on some simple but really effective prevention strategies during recovery.
Oh, yeah. Like what?
Basic stuff, but powerful. Staying hydrated, aiming for at least 64 ounces, like 8 glasses of water a day, unless your doctor specifically told you otherwise.
Okay, hydration.
Early mobility. If you're able, getting up for short, maybe 5-minute walks every hour or so while you're awake helps prevent clots and other issues.
It's gentle movement. And being disciplined with medications, especially pain meds. The advice was never skip your dose right before you have to do something tough, like a physical therapy session. Manage the pain proactively.
Simple, but makes a big difference.
Huge difference. And that Supremedic Lifelines podcast episode, the one called Douse Monitoring for Complications, was mentioned as just one example of how important this kind of post-treatment guidance is.
So guidance is out there, and it seems like the sources also wanted to warn against common mistakes people make.
Definitely. They highlighted things to avoid. Like, don't just dismiss pain that's getting worse as, oh, it's just part of healing, without checking it out or telling your team.
Right. Don't ignore signals.
Don't rely only on what you find online. Always check with your actual medical team. Don't wait too long if you really suspect something is wrong. Prompt action matters.
Better safe than sorry.
Exactly. And maybe the biggest one. Don't assume that just because you've been discharged from the hospital, you're done and can stop being watchful. Recovery is an active process.
Okay, so let's try and tie this all together. What does it all mean? We started with accreditation bodies like JCI and NABH setting quality standards inside the hospital.
Right, laying that essential groundwork for safety within the system.
But the sources just make it incredibly clear that your role as the patient or caregiver, doing that careful observation and taking action after you go home, that's a direct, crucial extension of that whole quality and safety chain.
Absolutely. It's not separate. Your vigilance connects directly back to the goals those standards are trying to achieve.
What's fascinating here is seeing how these big systemic efforts towards quality really intersect with your individual actions day by day at home. That combination is what leads to a successful recovery.
Yeah, your informed monitoring, your awareness.
Yeah.
It effectively becomes part of the hospitals or the healthcare system's early warning system. You're the front line once you're home.
It really shifts the perspective, doesn't it? It's easy to think the main event is over when you leave the hospital.
Right. But recovery, as the sources describe it, isn't just that moment treatment ends. It's a whole distinct phase, an active phase.
Which leaves us with maybe a final provocative thought for you, the listener, to chew on. If the formal medical treatment is officially over, does that mean your period of most intense watchfulness has actually just begun?
Something to really consider as you navigate that post-treatment time.
Absolutely. Well, thank you for joining us for this deep dive.